Hey guys, it's Maggie and I am back today to talk about what else? My ostomy bag. That's right. I know I talk about it a lot on my channel, but every once in a while a video will get traction and suddenly I get a ton of questions, and a lot of them are repeats. So I like to come on here every once in a while and answer these very common questions. A lot of people do not have close encounters with a stoma, with an ostomy bag, because they probably don't have one or they don't know anybody close to them that lives with one. So that's why I am here, because you know what? There are actually a lot of people that live with stomas. Young, old, medium age, I don't know. A lot of people live with stomas. I know in the US it's somewhere from 250,000 to 1 million people have stomas. I have seen them out in the wild. Like, I have actually seen somebody, without saying anything myself, lift up their arms and their ostomy bag pops out. In my college dorm, there was another person living with a stoma, and there was 2 other people living with the same disease that caused mine. So we're gonna talk about the most common things that I come across, the most common questions that I come across online when it comes to living with an ostomy. And as we do this, I think it's important to do a bag change, because I am definitely due for one. I think the most common question that I personally get about the system that I use is, why the heck do you use a non-drainable bag? A lot of ostomy bags have a way to drain them at the bottom. Usually it's some sort of Velcro closure. Right now, clearly that's not what I'm wearing. I will be changing into that though, because I do have a bag that I like with the Velcro closure. I have what's called an ileostomy. There's actually a few types of ostomies. There's colostomy, urostomy, and an ileostomy. That means it's made from my small intestine, the red part you're about to see. Essentially, because I don't have my colon anymore, it means that less water is being absorbed back into my body, and therefore the output, or the feces, the stool, whatever you want to call it, coming out of me is a little bit looser. It's a little bit more watery, meaning it's going to happen more often. I'm going to have output more often, and I'm going to have to empty it more frequently. This bag is more for somebody with a colostomy who might have slower output, might have to empty less frequently. The reason that I like to use this system a lot is because I've had issues with the Velcro closure leaking before. I have even had it with this bag a few times. I also find that this is very low profile. When I first got my ostomy, I used to use a clip. Ugh. I hate clips. I do not trust them. That thing had popped off, and it also was kind of bulky. It would show under my clothing. I'm trying to think what else. I also find that these non-drainable bags are a little bit smaller, although you'll find that this one's actually a pretty good size. It's a little long for me as a short person. It's not too bad. I'm trying to think. Also, I do actually still empty these bags. What I do, because this is a 2-piece ostomy bag, meaning that the part you see right here is the base plate, the wafer, the flange that sticks to me, and the bag can come unattached from that. I will take the bag off of that and empty from the ring. I will take the whole bag, go over to the toilet, empty it upside down, and then make sure the ring is all clean and reattach it to myself. I know that's an unusual way to do your ostomy bag, but I've been doing it for so long. There are so many different ways that you can care for an ostomy. There's not one single right way, and I think that's a really important message to give. I often get a lot of advice like, oh, you should be using this product, or you should be doing it this way. There's so many different ways to do your ostomy care, and there's really, it's an art. We can all do it our own way that works for us. Let me go start my change, because I'll keep talking if I don't do that. One question that I get quite frequently is, why would somebody so young have to live with an ostomy? And I actually worked as a GI nurse. I worked with ostomy patients directly as a telehealth nurse, so I have a bit of experience with a number of different patients living with stomas, permanent and temporary. And I have seen fairly young babies get stomas, unfortunately. It's not just colon cancer or colorectal cancer that causes you to have an ostomy. My personal reason is Crohn's disease. I got a pretty severe case of it when I started having symptoms around 8 years old. And it really progressed very badly, and my colon and rectum were essentially destroyed. Because of that, I wound up with my ostomy at the age of 16. Now I'm 32, so it's about half my life I've been living with this thing, and honestly, it has made a world of difference for me. It really did give me my life back, because I was living in the bathroom, so that was not fun. Gotta get some toilet paper just to make sure, because sometimes my stoma is active. And by the way, his name's Leroy. Another question that I get frequently is, what's the maintenance on this thing? What do you do daily to care for it? So what you see me doing right now, I'm gonna peel my ostomy bag off right now. Let's see how the skin's looking. This removal and replacement of my ostomy bag happens every 4 or 5 days, I would say. Sometimes I go longer, sometimes shorter. It just depends on how the bag's sticking and how I feel. Now, I have noticed a cultural difference with ostomy changes, which is kind of wild. There are some places where people change their bag daily, and I guess depending on how their ostomy stuff, their supplies are paid for, they can do that. Typically in the US with our insurance, it's 20 bags you're approved for per month. So we're not changing it daily here. That's pretty uncommon. And I typically get longer. I kind of have the theory or the method of, you know, you don't want to be peeling off really good adhesive from your skin too frequently, or else you might actually cause skin damage, especially if you have healing skin. You might be peeling off healthy layers of skin. Now, there is adhesive remover spray and wipes. I use them. You know, I didn't use the spray here. I didn't feel like I needed it because this bag it's going to peel off on its own. But you can use that to help remove the bag. I will use adhesive remover wipes to clean my skin pretty thoroughly. So when it comes to this full change, I know it looks like a lot of work, but I'm only doing it every 4 to 5 days. In real life, when I'm not chatting in a camera, I'm typically getting out of the shower. I would have peeled my bag off in the shower, gotten out, and let my skin dry. It probably takes me about, I don't know, 10, 15 minutes, maybe less than that. It's pretty quick. But I'm chatting with you guys, so it's gonna be a little slower. When it comes to emptying my bag, this is probably happening, I don't know, 5 to 7 times a day. It depends on what I've eaten, how I'm feeling, my hydration level, all these things. Sometimes my output is really thin and frequent, and I might have to empty more frequently. Other times my ostomy is a little slower. Maybe I had some broccoli or a lot of bread or something, and I don't have to empty as frequently. Overnight, I might have to empty once, but thankfully, you know, it's like it slows down after a little bit. Right now I'm just cleaning with a little adhesive remover wipe. It really helps me get all of the gunk off of my skin. You want a clean, smooth surface to adhere your new bag to. Otherwise, you might have a premature leak. Nobody wants that. And excuse the crying baby. My husband's watching my daughter. So yeah, in summary, changing it every 4 to 5 days, emptying it 5 to 7 times a day. I always get the question too of, does this mean you don't go to the bathroom anymore? Which is a super valid question. So when it comes to going number 2, I just go in the bag. It all goes into the bag and then I empty it. When it comes to other things like peeing, no, I sit down normally and I use the restroom the old-fashioned way. Nothing is different there. It's just for bowel movements, it goes into the bag. And honestly, I think it's so much more convenient. Like imagine having a meal and it doesn't settle well and you find yourself running to the bathroom multiple times. If that happens to me, I can just sit on the couch and, you know, maybe I have to empty every so often, but I'm not adhered to the toilet. So, you know, little bonus thing for having a stoma. People see the red part, you know, that is the actual intestine, and they say, how does that not get infected? Like, you need to be wearing gloves, you have to do this sterile, because you know what? It's red, it looks like an open wound, and you have stool coming out of it. How does it not get infected? What you are seeing is intestine, and the way a stoma is created, it's actually so cool what they can do with stomas in your intestine and honestly in surgery in general. But the way a stoma is created is, imagine this sleeve here is your intestine. It's separated from the lower bowel. It's brought through the abdominal wall, and then it's actually turtlenecked back onto itself. And this portion right here, the end of the cuff, is what's sewn to the skin. So what you are seeing is actually the inside of my intestine, and the inside of your intestine has a lot of blood flow. When it's healthy, it's well perfused or has really good blood flow. So it's going to have that beefy red sore look to it. So people assume that it's sore or it's infected, and that's not the case at all. It's actually really healthy. And I know I get a lot of comments always saying, you know, you're doing your stoma care there. Why the heck are you not wearing gloves? Valid question too. If I was back in the hospital working as a nurse taking care of a patient, of course I would be wearing gloves to handle their stoma care. But at home, the way that I see it, it's like wiping yourself after you go to the bathroom. Like if you don't wear gloves wiping yourself, I'm not gonna wear gloves handling my own stoma. It's my own. Of course, I practice good hand hygiene. Make sure your hands are clean, wash them thoroughly afterwards. But I feel comfortable enough not to wear gloves. Some people do wear gloves when they do their stoma care because they're a little, you know, they got the heebie-jeebies when they look at their stoma and feel their stoma. It's exactly how you think it feels. Like imagine a slug, okay? That's basically what it feels like. Now I've had this stoma for 16 years and people always ask me, why did I not get it reversed? That's a really good question. And the reason is I couldn't. This was actually made as a temporary stoma. I still had my colon and rectum when I had this done originally. But as time went on, my colon and my rectum just got wrecked by Crohn's disease. And it also included the anus, like even the sphincter was damaged. So in 2019, I made the decision to get rid of all that, the colon, the rectum, close the anus up. That's right, there's a missing hole. And that means that I am not qualified for J-pouch surgery or anything like that. I could do an internal continent pouch, which is very interesting, like the BCIR, or I think it's the Coke or the Cock pouch. But I don't want to mess with success. I feel like I've done so well with my ostomy for 16 years. Why ruin it? I also get questions about things like pregnancy, which to be honest with you, just a year and a half ago, I really couldn't tell you much about. I knew that I had friends that had gone on to have successful pregnancies, but I myself was dealing with infertility. Well, now I can tell you that pregnancy is possible because I've experienced it myself. And I just had a baby about 7 months ago, baby girl, and everything went swimmingly. I had a vaginal delivery. I went into labor on my own. My water broke on its own. I did not even need an induction or Pitocin or anything until after, you know, just to help the uterus not bleed out. But honestly, it was like amazing. And I felt the best I had felt during pregnancy, which is pretty common too. So yeah, you can have a baby with a stoma. Isn't that so cool? People also wonder about swimming and bathing. Like, how do you get your bag wet, or can you even get it wet? I had always said previously, like, there's no problem, your bag should stick in all water, but then I started to have issues with my bag sticking in water. So I take that back a step. Normally, in most circumstances, ostomy bags have no issues going into water. If you're submerged for a really long time, it might start to peel up on the edges, but you're probably fine. But in my own experience, I started to have skin issues where my bag, if it was exposed to any sort of water or moisture, even sweat, it would start to peel up like crazy and it would cause a ton of skin irritation. It was like this circle of wetness causing skin irritation and the skin irritation causing more wetness because my skin was weeping. It was awful. So I don't want to put a blanket statement and say, water's fine. But for the most part, you know, I just get in the shower now. I have no problem. The bag doesn't peel up like crazy and we're good to go. All right, let me use a hairdryer real quick to dry my skin. People are also really curious about your intimate life with a stoma. Okay, so I can hear my baby screaming downstairs and my husband. So clearly I've had an intimate life, all right? There have been incidences, and the dog's barking. There have been incidences in my life where my ostomy bag has leaked, during intimate moments. It has fallen off completely during intimate moments. And honestly, you just have to have a good person with you, a good partner to help you handle those moments. It sucks, but I personally don't find that the bag gets in the way. The only annoying thing for me is sometimes bags crinkle, and that can be very distracting. But other than that, it's not a problem. Like, I'm good. So, I'm grateful for a husband that is so supportive, who just does not, he did not care when I met him. We've been together for a long time now. He didn't give one bleep about me having an ostomy. Do I have dietary restrictions with this thing? You know what? Sometimes things like raw broccoli or veggies that are really hard, that can cause a blockage and make it so my output can't come out like it should. But I just make sure that I chew my food thoroughly, and I don't really have too many issues. Sometimes foods like meats or fish will make it a little too fast and watery. That can be irritating, and if I eat food like that, I'll eat like potatoes with it. That'll help slow me down. So I don't have any solid things that I definitely have to avoid. Some people do, some people don't. That isn't really like a standard thing across the board between ostomy patients. It'll look different for everybody. This question, I have to be honest about it. How do I feel about having an ostomy, especially a permanent one? I hate it. Like, let's be real. I do not picture myself when I was a kid living like this. It sucks. It does suck. It was a hard surgery to go through, and there are daily struggles that come with living with an ostomy. But the thing is, the ostomy is not the enemy here. The Crohn's disease is the enemy, and the ostomy is what gave me my life back. So I try to remind myself of that, and I have adapted really well to ostomy life because I just look back before I had one and the amount of time I spent in the bathroom and how sick I was. It was god-awful. I had no life, and I was a teenager. Once I got the stoma, I realized I can play soccer again. I can go swimming again without, where's the bathroom? I can go in the ocean. I can live my life. I can grow and gain weight and fit into adult clothing now. Like, it gave me a lot back, and even though I hate that I have to live with one the rest of my life, I think I'd really hate it more than if I didn't have it. Like, I hate it, but I do love my ostomy because it gave me my life back. Now that my skin is dry, I can answer the question that I get from assholes all the time. And the ironic thing is, I don't have one of those, but there are so many of them in my comments. But there are way more supportive people. Okay, people ask, why the heck do you show this? They seem to think that I show my ostomy for vulgar reasons, like, oh, look at how disgusting this is. Actually, I'm trying to show the opposite here. I'm trying to show how normal this can be. I go about life, I'm married, I have a baby, I worked as a nurse. I had a normal life because of my ostomy. But when I got my surgery at 16, it felt like none of that was going to happen. It felt like I was going to be in a bed, in my home, not able to leave. Life looked bleak. And I know people in real life today choosing to not get an ostomy and choosing death, letting cancer run rampant in their body because they are so fearful of this life. That is why I show it online. And the funny thing, I'm just like, if this content does not apply to you, if you don't have an ostomy yourself or you don't have a loved one with it, it's like if you're not interested in makeup videos, don't watch them. But, people are silly. I'm showing it for the people who are afraid, the people who are curious about what it's like to live with a stoma. I'm not showing it to the people who think it's gross, because honestly, I'm wearing a medical grade plastic over my bowel movements. They're just walking around with a potentially floppy anus. I'm just saying, this is a joke. This is a joke. That's kind of my attitude about it though. You know what? You don't have to watch it. Totally fine with me. I do not care. I'm showing this because people need to see it. And there are people that go into the hospital to get this surgery and get almost zero education on how to manage it. I had a patient who simply did not speak the language of the majority of the hospital he had the surgery in, and got no education, no way to get supplies, literally knew nothing about his ostomy. He went home with the stuff they gave him in the hospital. And so I got on a call with him and a translator, and we were able to just lay it all out, like, this is what it's like. So that's why I make videos online about it and try to talk about it as much as I can and share the products and share my knowledge if I can, you know, if I can give a little piece of information that somebody was lacking. Cool. Anyways, now my ostomy and my skin feels so much better. It feels like it's sticking. I still hear my husband and Novi. I hear them chatting away down there. They're having fun without me, so I'm gonna go get us some lunch. I'm gonna wash my hands, don't worry. If I don't show it, people think I don't do it, but I'm gonna wash my hands and I'm gonna enjoy the day. So thank you so much for listening to my most common questions with my ostomy. Potentially again, if you've been here for a while. Yeah, I'll see you guys in the next. Bye guys. Thank you so much for watching today's video. If you are looking for a way to help support my channel, consider liking this video or even subscribing. You can also check out my store at LetsTalkIBD.shop. I have stickers and hoodies like these guys over here, just related to chronic illness and inflammatory bowel disease, something fun. And I also have a coupon code for my YouTube watchers. You could also become a member of my channel like the wonderful people scrolling on screen here. They've become a member and they have access to videos a little bit earlier. It's a great way to support my channel, and really, just watching my videos means the world. Thank you so much, and I'll see you in the next.